Hello and welcome to the Ophthalmology Management 25th Anniversary live stream. I'm Zach Tertel. I'm the managing editor of Ophthalmology Management. The November edition of our publication was our 25th anniversary issue, which you should be seeing in your mailbox soon, or you can view on ophthalmologymanagement.com right now. So that issue celebrated the last 25 years of ophthalmology, including the 25 biggest developments and 25 leaders in innovation. We have a great panel here today to talk about that, as well as a brief look forward to the next 25 years. I'd like to introduce our panel now. First, we have Doug Parry, who is Ophthalmology Management's Executive Vice President and Publisher and was instrumental in the start of the publication. We have Larry Patterson, who served as Ophthalmology Management's Chief Medical Editor for the last 13 years and is the founding partner of Eye Centers of Tennessee. We also have Dr. Lisa Fulner, founder of Advanced Eye Care and Aesthetics in Bel Air, Maryland, and starting in January, will be taking over as our newest Chief Medical Editor. So thank you all for joining us. Right now, I'm going to pass things over to Dr. Patterson and the panel to talk 25 years of ophthalmology management.
Thanks a lot, Zach. Well, in the time we have, obviously, we're not going to be comprehensive in covering the last 25 years because we could be sitting here for days talking about that. But as Zach mentioned, I've been chief medical editor of this publication over half of the last 25 years, and I've seen a lot happen. And I was asked recently to write an editorial. We actually, that'll be coming up soon, talking about some of the technologies that really stood out during that time. And I'm just going to kick this out by talking about the one technology that really impacted us the most, and that was the whole field of retina, OCTs and anti-VEGF injections. While OCTs has other applications in glaucoma, and as a comprehensive ophthalmologist, we cover pretty much all the fields. OCT as a diagnostic tool in retinal diseases, especially discerning between wet and dry macular degeneration and the vascular diseases like branch retinal vein occlusion and all the diabetic retinopathy and edema and things like that has just been amazing. And then just hand in hand with that is the all the anti-VEGF injections that came out one after another. And I remember starting practice when people came in with subfoveal occult neovascular membranes. They were just going to lose their vision. There just wasn't anything we could do. All we had was laser. And if it was subfoveal, which so many of them were, if not most of them, you couldn't laser it or you destroy their vision. So the only thing you could do was treat the ones that were outside the fovea to hope keep it from extending. Even then, you left the patient with a huge scotoma. But that was, you had people with macular degeneration that would get it in both eyes, and once they went legally blind, a lot of them would never return. And it was just a completely different era of time. Now, probably 1 out of every 3 or 4 patients I see all day is coming in for some sort of retinal disease treatment. So by far for me, that's the one that stands out the most. Let me kick it over to Lisa and see what her thoughts are regarding technology changes in the last 25 years.
I agree with you, Larry, about OCT, but in my practice, if I think about what has changed the most, aside from some obvious changes in what we can do with cataract surgery, refractive cataract surgery, with the advent of femto and presbyopic lenses and toric lenses, and the choices and variety of things that we can now do for patients to improve uncorrected vision and satisfy all of their visual needs. For me, what's really changed is my ability to diagnose and treat glaucoma. So like using the OCT now, we can move way further back in identifying people at risk for losing vision. We can actually look at the retina now and look at the ganglion cells and detect and diagnose and treat earlier. But even more so, we have some tremendous innovations in MIGS surgery for, any kind of surgeon can really handle treating patients earlier in glaucoma before we need to necessarily send them off for something more invasive. We have all sorts of MIGS and we have suprachoroidal surgeries. We have, viscodilation of the trabecular canal, we have a lot of options now to surgically treat people. And in addition to that, we have technologies that, we can insert medication at the slit lamp for people who can't afford or can't physically put drops in their eyes. So our ability to diagnose and treat blinding diseases, like you said, the retina, for me, glaucoma, our ability to diagnose and treat early these blinding diseases has been a phenomenal innovation. I think that we're even getting better with ability to do things like corneal hysteresis to judge different types of risk factors for people. I just think that when we think about, a lot of us who are comprehensive ophthalmologists, we get excited about cataract surgery and refractive surgery. But really, the most impactful things is what we do for those blinding diseases like retinal disease and optic nerve disease. So those innovations are definitely have been practice changing for me.
Yeah, you're absolutely right. I mean, as you were talking, I was thinking back to the day when I started, and you basically put in one drop, then another drop, then a third drop, then you added Diamox. And if that didn't work, you pretty much went to trabeculectomy. And glaucoma is a whole lot more fun to treat today now. Doug, from a non-medical but ophthalmic publishing standpoint, what are the things you see?
Yeah, well, I have to represent the patient's perspective here, I guess. And, patient care begins with technology. So I am absolutely grateful for the advances that have consistently been made in the field in all aspects, in cataract, retina, glaucoma. It's just amazing what has transpired and how far we've come. And I just have to, give out kudos to Zach and Jim for the November issue, because if you were just starting in ophthalmology now and needed to know what has transpired or taken place during the last 25 years in the field, our November issue just is an excellent recap of the highlights of ophthalmology as far as technological applications and patient care, key developments. It really is an amazing issue, and I'm excited to have it coming out shortly. So we have to give thanks to the vendors who have persisted in investment and coming up time and time again with advances in the technology in all aspects. So it really is a marvel. There's no other way to say it. And we've been fortunate to be a participant in that, and also be a benefactor of that of that history. So it's fantastic.
Well, I absolutely agree, and I've had a sneak preview of that issue, and it's a real trip down memory lane. I think it's one of those issues you'll want to just pick up and start at the beginning and go through the whole thing. As we think about ophthalmology management in particular, thinking in terms of, I ask each of you a favorite moment, a favorite issue, something specific that you remember about ophthalmology management in the last 20 years. I'll start with you, Lisa. Anything come to mind?
So, I ventured out and opened my own practice in late 2003. In fact, we're coming up on our 18th anniversary on November 4th. And I literally had no experience in business. I really didn't have a lot of connections or mentors or people to guide me. And ophthalmology management, came in the mail when I first had my office. And I literally used that as my resource for answering and guiding questions about practice management. I mean, there's always great articles about things that you need to keep in mind, and efficiencies and coding and, legal issues and malpractice issues. And then also, learning, what do I need to do next? What are the next things I need to bring to my practice? Always guiding me throughout my entire career for helping me move on and giving me that knowledge and that mentorship that I didn't have. And I think today, the younger ophthalmologists have more opportunity for mentors. When I started, there weren't a lot of women in ophthalmology, and I certainly didn't have any business or, physician mentors. So ophthalmology management was like in my back pocket. It really was such a huge resource. And as my practice has developed, and now I'm a considered a mature ophthalmologist. I use it differently. I really use it. And like today, I just picked up one of the issues today, and I put stickies all along, like articles I want somebody else to read in my office, articles I want to read, and it's still this tremendous resource for me. There was an article about coding and can you bill cataract surgery on a week afterwards? And it really, one of the things that, I've talked to Doug about and I've talked to Zach about is staying relevant in this world. And every article is so relevant. There's always something in there that is a question that I needed answering. Like literally just today, I found an article for a question that I asked last week of my staff. So for me, it's been such a great resource. I'm really excited to be part of it and keep it being relevant and progressing through the next 25 years.
Doug, from your perspective, what in the last 25 years really stands out to you as the publisher?
Well, I can't believe that we've produced 300 issues. That's the amazing thing that I've observed is that 300 issues of ophthalmology management have been produced. And Lisa, what you just said is so true. It's kind of what we get excited about. We get comments from ophthalmologists saying, in every issue, there is something that I can integrate into my practice or apply to what we're doing that makes a difference. I mean, that is the best kind of compliment that we can get, knowing that we're making a difference. That's what we've always strived to do. But in looking back, from 1997 to now, I really do believe that the November issue is one of our best. They've all been fantastic. I'm the publisher, and there's a lot of intake on that. But I would say the Dick Lindstrom article in '99, also about my $100,000 a day practice. That was a landmark. That was definitely something that was an amazing yardstick that we got out there. But we've really just tried to set our sights on being behavior changing, help doctors practice smarter. So that's pretty much the bottom line.
When I think back in my career, which now spans well over 30 years, ophthalmology management was one of the just like what Lisa said, especially earlier in my career, it was what you went to. It was the place, the go-to magazine for how to run your practice. And I know that Doug and his company will hire independent surveyors who will look at all the publications out there. And ophthalmology management always comes on top of things like, the magazine that you're most likely to read from cover to cover, the one you're most likely to tear out articles, like Lisa said. I mean, we do that all the time. And, what I've enjoyed is ophthalmology management by and large is a serious magazine. It's about serious matters, but I've been given the role to do whatever I wanted to in my little column that for many years was every single month. As the last few years, I've been every month or every third month. But following in the footsteps of Paul Koch was really intimidating and everything. But as time went on, I started finding ways. There's a way of finding the humor in almost everything. But I was thinking of all the editorials I'd written, the hundreds of editorials over the years, and it occurred to me that the one that got the biggest reaction, the reaction specifically was from the American Academy of Ophthalmology, and I always had a pet peeve going to the Academy and ASCRS and these meetings when you had your little name badge, but you had the opportunity to put ribbons under it. And I always just thought that was so stupid. Because you had people that had ribbons on top of ribbons, and it was really getting out of control. I saw one time a guy had them splayed out like this, like a peacock. He had about 20 ribbons, and I remember one time actually going back to my room and trying to figure out how to put the ribbons on the badge, and I kind of called for an into it. Well, I got feedback from the AAO office. The staff there said it was the best editorial they had ever written. They were so excited because they said in the year's time, the biggest problem they had with the Academy meeting every year was all the issues regarding the ribbons and people not getting the ribbons they felt they deserved and stuff like that. So I was just doing it as just a funny thing to write about because I was always making fun of the ribbons, and it turned out it actually had some practical values, and I've noticed most of the meetings have dropped a whole lot of the ribbons. Any other before I turn it back to Zach, Doug, Lisa, any other thoughts as we look toward the future? And I want to say, add to what Zach said. I told Doug when I agreed to this 13 or 14 years ago, I figured I'd do it a couple years. I had no idea we'd be going this long, and for the last several years, I keep telling Doug, you sure you don't want to get someone else? He's no, we're fine with you, Larry. But I'm really excited about the transition and Lisa taking over in this role, and I think we'll all be better off for it. But Doug, Lisa, any other final thoughts?
Well, Larry, I just want to thank you for your leadership and your guidance of ophthalmology management during the last 13 years. It's been a pivotal time. Ophthalmology management's risen to the occasion, and just appreciate you being there and giving us insight and being the guiding light on ophthalmology management's direction. So we're thankful for that. And Lisa, we're excited to have you here on board and blazing a new trail from this point forward. So,
well, I certainly have big shoes to fill. And Larry, if you look at this 25 years, like you said, you're big part responsible for the success and the content. So, I thank you for laying the groundwork for me and the blueprint for moving forward.
Or you're with a group of good people. Well, Zach, we'll turn it back to you then.
Yeah, thank you. Thanks, everybody. I appreciate you all sharing your memories of the last 25 years in ophthalmology and ophthalmology management. That's about all the time we have for today. I want to thank you all for joining us. Again, Larry, thank you for everything you've contributed to the publication in the last 13 years. And Lisa, we're excited to have you on board as well. So I hope everyone enjoyed this live stream. And yes, we invite you to check out that November 25th anniversary issue of Ophthalmology Management.